Welcome everyone to My Weight World TV. I'm Dr. Brenda, MD. Joining me today is Dr. Joseph Franco, a board-certified plastic surgeon. He received his training in general surgery at Loyola University. He's board-certified in general surgery and plastic surgery and received training in hand surgery and microsurgery. He's been in private practice for 13 years in the Chicagoland area. Welcome, Dr. Franco.
Welcome. Good to be here.
Let's start out with telling me a little bit more about yourself and how you became involved with plastic surgery.
I'm a board-certified plastic surgeon, as you mentioned. I've been in practice for 13 years in the area. I became involved in plastic surgery during my training at Loyola University. After being in general surgery, I had the opportunity to experience plastic surgery procedures. I felt that it was a very diverse field. I liked what it did for the patient population, and therefore I proceeded with plastic surgery after my general surgery training.
What is your philosophy when dealing with overweight or bariatric patients?
The bariatric population is very interesting. While these procedures are sometimes considered cosmetic, I feel that there is a reconstructive component to them which fits in with my practice and my background in reconstructive surgery. The patient population also has a significant emotional component attached to these procedures, which makes the dynamic between the patient and physician relationship quite interesting.
What are some of the typical procedures that you do perform?
Bariatric patients require usually multiple procedures, generally in a staged fashion. Those procedures include reconstruction of the truncal area, including abdominoplasty, lateral thigh lift and buttock lifts, removing excess skin from the arms and thighs, known as brachioplasties and thighplasties respectively, in addition to breast reconstruction essentially due to the destruction of the tissues of the breast area following weight loss. And then multiple facial procedures, including facelifts and brow lifts if patients require those procedures as well.
Right, because after you lose weight...
Absolutely. Generally what happens after you have stretched out the skin during those periods of being overweight, the skin often loses some of its elasticity, and that occurs on every part of the body, the face, the trunk, the arms, and the lower extremities. So in similar fashion, you'll have excess skin at these areas that don't necessarily respond or recoil following weight loss.
And that's where the reconstructive surgery.
Absolutely, and it becomes disappointing to patients to find that these tissues don't recover with the rest of their physical being.
Right. How about we talk a little bit about the tummy tuck, abdominoplasty. Tell me a little bit more about it.
An abdominoplasty addresses the issues of the lower central abdominal area anteriorly. We address three components. In the front. Yeah. Three areas, including the skin, the subcutaneous tissue, as well as the integrity of the abdominal wall itself. Oftentimes, patients who had been significantly overweight not only have excess fat under the skin, but as well as intra-abdominal, behind the abdominal wall, therefore causing stretching out of the abdominal wall itself. So we remove excess skin. We sometimes have to do concomitant liposuction, as well as tighten the abdominal wall itself.
And you just go in there and take that out?
Well, the abdominal wall itself obviously isn't removed. It is tightened in a similar fashion as a hernia repair to reapproximate tissues that maintain the integrity of the abdominal wall itself.
Okay. Does a patient need to prepare for, let's say they were scheduled for an abdominoplasty, is there any preparation that you require for your patients prior to the procedure?
With all the bariatric procedures, we would like the patients to have plateaued in their weight loss. Generally 12 to 16 months is ideal to make sure that they've reached their ideal weight, and that metabolically and physiologically their bodies are ready to handle what can sometimes be larger procedures. So we do ask for patients to be seen by their primary care physicians or their bariatric physicians to make sure that they are clinically capable of going through these procedures. Certainly, we don't want people smoking during these procedures. That causes some of the highest rates of complications in smokers, and therefore we strongly suggest against that. Other than that, we watch medications that patients are taking, especially aspirin. People understand that that increases bleeding, high doses of vitamin E. And some of these over-the-counter products nowadays become very challenging because people think that they have no clinical effect, but we have to watch those very carefully as well.
Right. So plateau their weight, follow up with a primary care doctor, get
Yes.
clearance, stop smoking, and blood pressure control and all that too.
Absolutely.
Right? Okay.
Yeah.
Let's see. Let's talk about these procedures cosmetically. Are they cosmetic procedures?
As I mentioned, I think it's a dual component. I mean,
Okay.
certainly these aren't life-saving procedures. We're not treating a disease. But in the patient's mind, and which is most important, the patient's mind, is they're trying to restore their body. They're not looking to enhance their bodies. They're trying to restore them to what they envision themselves now mentally and emotionally since they've lost the weight. Therefore, it does have a profound effect on these patients, probably more so than your typical cosmetic patients. So I do think, in my mind, it's a cosmetic procedure with reconstructive ramifications. The breast surgery, for example, is not typical of your cosmetic patient in that the tissues have gone through so many changes and the procedures are challenging compared to your typical cosmetic patient. So I think it's a components of each.
Okay. Does insurance typically pay for these procedures?
Unfortunately, no. As you know, the insurance environment or economic environment doesn't allow for insurance companies to cover for these. There are some few exceptions to this rule, but in general, I think it's disappointing to many of the patients to find that these aren't covered for the reasons I mentioned. That in their hearts and minds, they feel that this is not cosmetic and that they're trying to restore their body, but unfortunately, insurance issues go beyond the patient-physician relationship.
How do these procedures change the lives of your patients?
These procedures have a profound effect on these patients, both emotionally and physically. When patients undergo post-bariatric procedures, such as the brachioplasties, the breast surgery, and abdominoplasties, it allows their physical appearance to meet their current emotional situation and state of mind. They regain confidence in their ability to participate in both social as well as workplace relationships. And it gives them the confidence that they've lost at some point in their life and allows them to get back to the person that they know that they really are inside.
Oh, that's great. Very fulfilling profession.
Absolutely. It's been a joy, yes.
Yeah. Well, thank you for joining us.
Thank you.
And thank you for joining us. Please tune in again to My Weight World TV so we can help you reach your goal with our community. I'm Dr. Brenda, MD, and thanks for watching.